This is Amanda Sweeney with the Christian County Health Department. I'm the Marketing Specialist and Public Information Officer here. And we're doing this presentation because we've heard a lot about the coronavirus lately in the media. We've heard a lot about it with community partners, and there's been a lot of concern out there about coronavirus. So we wanted to take this opportunity to speak to you out there, whoever may be listening to this presentation, give you some tips and pointers on how you can protect yourself and protect your facility, and just give you some more information about coronavirus and what we currently have going on. Coronavirus is actually an umbrella term. There are several types of coronavirus, and they get their names from the crown-like spikes that come off of the surface of the virus. But you've got other viruses that we may have heard of called SARS, MERS, which is the Middle Eastern Respiratory Syndrome. So this latest coronavirus is COVID-19, we're calling it. And this is the one that we've been talking about lately. You've seen so much in the media, and we've been preparing for. It's the one that's been spreading and making people sick. It spreads much like the cold and the flu virus. Statistics as far as how many cases we've had so far and number of deaths, all of that is continuously changing. But so far, as of March the 12th, Chinese health officials, they've reported more than 80,000 COVID infections or COVID-19 infections in China. So far, we've had about 1,215 cases in the United States, 36 deaths. In Kentucky, as of March 12th, well, there have been about 8 confirmed cases. And like I said, these numbers are always changing, but on this website at CDC, you can get the most up-to-date information. When we consider the risk factor or the health risk for COVID-19, right now we're not really sure how many are going to fall ill from the disease. We have our estimates. We know how quickly it can spread. We've seen that over the last few days in the media and as we track those numbers. We do know there are hygiene practices we can put in place to greatly reduce your risk of contracting it, but right now we're still learning a lot about the virus. But as we get more information on health risks and more things that we can do to help prevent it, we'll definitely make that known to the public. One of the things we do want to do as a health department and as a community, we want to spread the word to businesses and organizations, anyone who has large groups of people who come into contact with each other every day, just give you guys some tips and measures on how to prevent the spread of illness, just to offset some of the spread of this disease and hopefully reduce the risk. There are lots of things that we can do to help prevent the spread of illness. And as I'm talking, I'm going to say a lot employees and employers, but this could apply to organizations, to churches, to any facility where we have large gatherings of people or where people convene every day. So just keep that in mind. But one thing you can do is to keep hand sanitizer readily available for anyone you're around for these facilities. You can put them outside of restrooms and doorways, just have them sitting on tables. I know here at the health department we have them sitting in random places, so as you go by you can just get a squirt and rub it on your hands to help kill those germs whenever you think about it. We always like to keep tissue around for employees and make sure all of our employees have a box of tissues. If they cough or sneeze, they can wipe their nose with that and then encourage them to wash their hands afterwards. We have great resources, and the CDC has great resources as well, and we as in the health department can provide these resources to you. We can send them to you electronically, and you can print off hand washing posters to put around your facility just to encourage people and remind them to wash their hands. And you need to wash your hands for at least 20 seconds with warm water and soap. And there's a plethora of songs that you can sing while you do this. So you've seen a lot of memes probably on Facebook. But for at least 20 seconds, scrub your hands with warm water and use soap. If you have a conference room in your facility, make sure that you're frequently wiping down those table surfaces, wipe down the back of the chairs, and just all throughout the facility, any doorknobs or common places where people touch. Just be mindful of that, and maybe more so than usual, use Lysol or Lysol wipes and start wiping down those surfaces. That's really going to readily prevent the spread of germs. And also emphasize to your employees, if you're sick, stay home. A lot of times employees are worried about their sick leave or maybe they think they're out of sick leave. And we'll talk a little bit more about that later in the presentation. But please, 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 especially during this time, encourage employees who are sick and who may have symptoms of COVID-19 to stay home to not spread the illness. The CDC recommends, and this is just good general practice at any time, but anytime an employee, if they come to work and they're exhibiting symptoms such as coughing, shortness of breath upon arrival, make sure you separate them from other employees so that they don't infect other employees. Send them home immediately. And sick employees, they need to cover their noses and their mouth with a tissue when coughing or with their elbow just to make sure they're not spreading those germs. And immediately after, encourage them to wash their hands again so they're not spreading those germs. Perform routine environmental cleaning. This kind of goes back to those conference rooms. More than usual, make sure you're cleaning those tabletop surfaces, just common areas where people frequently touch, maybe more so than usual. If your routine is to twice a week to wipe down everything, maybe every afternoon wipe down everything, or maybe give each employee their own box of Clorox wipes to wipe down their desk and their workspace. Actively encourage sick employees to stay home. And this is what I said we would talk about a little later in our presentation. Employees who have symptoms of acute respiratory illness, they're recommended they need to stay home and not come to work until they are fever free. And not just fever free because they've taken Tylenol to reduce their fever, but fever free after no medication and they still don't have a fever. After 24 hours of no fever, meaning they haven't taken any Tylenol to reduce their fever, if they haven't had a fever, they are considered clear or no longer contagious. Ensure as a facility or as an employer that your work leave policy or your sick leave policies, they're flexible, especially during this time. If you have employees who are running out of sick leave, but then they come up with symptoms of an acute respiratory illness and you suspect them of having COVID-19, make sure they're aware that we're going to be more flexible with those policies just so they don't come to work or feel obligated to come to work and spread that. Talk with companies if you have a lot of temp employees as well, just to make sure a lot of times they have jurisdiction over their temp employees. So make sure they're reminding those employees as well of the different ways that we can prevent the spread of illness and not to come to work if you're sick. We're asking that doctors or asking that employers are not asking employees to provide doctor's notes and doctor's excuses for being out during this time, simply because we don't want employees who are suspected of having COVID-19 to flood the offices wanting doctor's excuses or doctor's notes. This is just going to allow the physicians to pay attention and focus more on cases of COVID-19 and treat other cases as opposed to providing doctor's notes. Employers, they need to maintain, again, flexible policies that permit employees to stay home, maybe with a sick family member, because if during this time we're going to have a lot of sick individuals, we need to be more flexible and allow family members to stay at home and take care of these individuals. Especially during flu season and with any virus, there's a number of things that we can do to help protect our health. Number one, especially when talking about the flu, is getting your flu shot. You can get that at the health department or your local provider. Hand washing is going to be the number one thing. You're going to hear about that over and over and over, but hand washing is a key way to help prevent the spread of disease. At least 20 seconds, warm soap and water. You can also use hand sanitizer. Make sure it's at least 60% alcohol. Make sure you're not touching your eyes, nose, and face or your mouth. A lot of times we touch our face about 3,000 times a day on average. So just make sure, be mindful of that, to quit touching your face as much. Avoid close contact with people who are sick. If you're sick, make sure you're staying home, that you're not spreading that with other people. Cover your mouth when you cough or sneeze. Wash your hands afterward. And then clean and disinfect frequently touched objects or surfaces. Make sure that, again, those common spaces, we're wiping those down with disinfectant. As far as coordination efforts, this is a lot of information. I'm not going to read it all to you, but just to recap, Governor Beshear, he's working with state and federal officials and the Department of Public Health. They're partnering with agencies like school and child care providers. And what we're doing is just getting the latest information from the CDC and passing it down the line just to make sure everyone is staying informed. And on a community scale, we are encouraging those, per Governor Beshear, facilities and everyone to have a plan in place should we see the spread of coronavirus and see an outbreak here in our area. If we need to shut down, we need to have those plans in place of how we can continue those services or continue our pertinent services in the community if we have to make adjustments. And we're working closely with clinicians to make sure the providers are aware of and informed about the illness. Again, any new information that we learned, we make sure everyone's in the loop on how to treat it, how to prevent it, so that we can prevent the spread of this disease. Last week, Governor Beshear urged Kentucky employees to offer paid sick leave. We've kind of already talked about that. But just make sure your employees are accommodated if they do have to stay home sick. And key officials, they've been in communication through this process. And always this information has been distributed to physicians as it's become available. So if you're out there, we are trying to keep you informed. We can do that via our Facebook page, website. The CDC also has great information and has up-to-date information that you can access. If you've traveled recently to China, Iran, Italy, any of the countries that's experiencing COVID-19 outbreak, or if you've been in contact with someone who's been there and you're exhibiting any of the symptoms such as shortness of breath, cough, fever, any of those things, then we ask that you contact first the local health department. That's here in Christian County. It's Christian County Health Department. We'll have our contact information available for you. But we've got an extensive screening process in place, and we're going to be able to put you to the right channels to make sure you get the proper testing. Department of Public Health also said that exposed people, they need to self-isolate. So before you come in, give us a call so that we can be prepared for you. Make sure you have the mask and the proper equipment before you come in and potentially expose others. Same thing with the emergency room or the physician's office. We ask that if you're experiencing these symptoms, not to just show up, but to give us a call ahead of time so that we can prepare for you. We've given you a lot of information for this presentation, but we wanted to give you some additional resources that's always going to have the most up-to-date information, as this is always changing. So the Kentucky Department for Public Health has a great Kentucky COVID-19 website that's dedicated specifically to the COVID-19 virus in Kentucky. You're always going to see the updated numbers for our area, and it's just a great resource for information. CDC website, again, another great resource. It's always going to have valid information that's up to date for you. So if you have any questions, you can always reference the CDC website. Christian County Facebook page. For our county, we're always going to be publishing the most up-to-date information several times a day just to keep you in the know. And then we've got our Kentucky hotline. And this is a great resource for anyone out there who might have any general questions about the COVID virus or COVID-19 virus, just to keep you in the know. And there's experts on the other end who are more than willing to answer questions. So I hope this presentation has been informative and answered some of your questions that you may have had. Again, if there is anything you want to know, these resources right here are great information for you. The health department is working in the community with community partners, putting plans in place should we have an outbreak here to address that in the best way possible. So we encourage you just to stay tuned, and we're going to be continuously updating you as this progresses.